Michael Barnes, your board certified psychiatrist. Depakote. I want to go over 3 ways in which I use or prescribe this medication to folks, okay? Number 1, it's for bipolar. So it does treat mania and potentially some depression, but it is better on the manic side. So anybody who struggles with mood swings, ups or downs, or specifically bipolar, then I do like this medication and I do use it for that. By the way, this medication has many different names such as valproate, valproic acid, divalproex, and even some other names. The second way in which I like this is agitation. I prescribe this for folks who struggle with symptoms related to agitation, so irritability, aggression, even violence potentially, and similar type struggles. There's some data, and I've had some success in giving it to folks to kind of tone down the brain and help with these kind of behaviors, especially in certain hospital settings where people are potentially dangerous, etc., but also in an outpatient setting. Now, the third way in which I prescribe Depakote, and this may be a surprise to some folks, but it is in the setting of TBI, or traumatic brain injuries. Now, this may be unique to me, but there is some research to suggest it could be helpful. And the way I look at it is a brain that has an injury or a concussion or multiple concussions, seizures, things like that. It's almost like bruising the brain. Imagine if you hit a muscle and you get a bruise on it. That's essentially what's happening to the brain during a concussion or an injury. And when it heals, the electrical circuitry of the brain is not firing completely correctly, and at times maybe even misfiring too high, almost like a light bulb that is flickering if it's kind of injured. And I've had some success in folks like that, adding meds like Depakote or similar to tone down the electrical voltage in the brain, and helps certain symptoms like headaches and other things that could, and concentration specifically, that could be related to traumatic brain injury.